Welcome everybody to the launch event for Human Right to Water, for which I'm the Chief Executive. My name's Amanda Loeffen. We've decided to choose a topic that brings together the critical nature of the current COVID-19 crisis with the need for including essential human rights in governance solutions. We hope that this topic will connect the realities that are facing all of us, but especially vulnerable people, with tangible human rights-based governance solutions. I hope that it will provide you with some food for thought and some enthusiasm for looking at the human rights to water and sanitation in a new light. My role as moderator is to introduce the expert panel today and to do the timekeeping. It's a tight schedule with 6 experts in human rights, water, sanitation and health. We also take this opportunity to introduce a few of the new board members who will be joining the question and answer session. First of all, I'd like to hand the floor to the President of Human Right to Water, Dhesigen, who will be introducing you to the organisation and the topic today. Dhesigen is the CEO of Water Research Commission, South Africa's only dedicated water research steering and funding institution. He also served as an official in the South African government, including time with the Ministries of Water Affairs and Forestry, Environmental Affairs and Tourism, and Science and Technology, where he served as Deputy Director General for International Cooperation and Resources. Des, would you like to take the floor?
Thank you, Amanda. I see I've been unmuted by the host, so I guess you can hear me. Dear colleagues and friends, it's very exciting to be here, and it's an incredible launch, and I feel really privileged. I have to tell you that June is Youth Month in South Africa. It is that time that we remember the heroes and the heroines who began the student protest movement on the 16th of June, 1976, that fundamentally altered the global view of apartheid South Africa as it was then. It was a turning point that exposed the human rights abuses of the apartheid ideology and the actions of an oppressive race-based state. And that point put in motion a series of events that eventually resulted in Nelson Mandela being inaugurated as the first democratic president of this new South Africa. It is therefore, for me personally, and many of my colleagues in this country and around the world, that this new organization, Human Right to Water, launches in this month. It is a privilege to be in the company of an incredible team of founder members, many of whom are on this seminar today, and you will meet them. And they all have incredible track records in this domain and are either members of the board or chair of the committee of experts. And of course, the CEO, Amanda Loeffen, and a wonderfully skilled team. COVID is the topic of our time. I think it's fair to say that it has fundamentally altered the world. It has become that unwelcome disruptor of the 21st century. In addition to the health, economic, and social challenges associated with the pandemic, it has introduced something else. It has introduced perspective, and it has introduced humility. In many ways, it has returned us to the basics. In the course of this, it has emphasized the primacy of water. It has emphasized the primacy of basic needs. It has emphasized the primacy of resources that many in the world take for granted, that so many more in the world have no access to. Water is a cluster, of course. It's not just water, but water and sanitation, and is paramount among these challenges and the mechanism around how we get out of this crisis. Ironically, it is in this time of global lockdown and local lockdowns when we have some of the most severe restrictions that we have experienced in modern times, that we are seeing and appreciating the primacy of human rights and a human rights-based approach to recovery and development. And this is absolutely key. So in this water sector, and I know that many of you are from the domain of law and policy, but as a water practitioner, I can tell you that the conservatism in this global water sector is truly a challenge. And it's been trying for the longest time to try and solve the water challenges of the 21st century, which is absolutely immense. Still far too dependent on 20th century technology and solutions, and even worse, on 19th century operating rules informed by outdated policy paradigms. This is truly a challenge in the world today. What we need and what is being promised is an innovative, creative approach, strongly informed by the Bill of Rights agenda that will enable us to not only successfully recover from this pandemic, which is paramount in everybody's minds at the moment, but to do it in a way that affords us to accelerate certain of the primary objectives that we have set for ourselves in recent times. One of those, and a very important one, is the Global SDG project, and in line with the UN Agenda 2023, and set course for a sustainable development paradigm for our future development trajectory. We can and must put our best efforts to register this COVID moment in future history books as a turning point for our global fortunes towards a better world. It is paramount that we put all of the efforts, intellectual and physical, into this project. And with a new organization like Human Rights to Water as a ready policy, legal, and strategy to support for different countries of the world and for different players in the system, we think we have made already a good contribution towards the way we can rethink the future agenda. So with that, colleagues, I'd like to welcome all of you, welcome you to this brand new organization, although I think it already has a history, and look forward to the possibility of us expanding this partnership to realize what is a very good aspirational goal. Thank you very much indeed.
Oh, thank you very much, Des. That was a good introduction to some of our speaker topics today, where we have quite a range of different experts coming to talk today about the responses that we think should and could be happening to the current crisis. Our first panelist today is Rio Hada from the Office of the High Commission for Human Rights, OHCHR, where he leads their work in economic and social rights and the human rights for older persons. Rio has been one of the faces for UN Water over the last 2 years through the Leave No One Behind programme, where we have enjoyed some joint events. Today, Rio is explaining how OHCHR is supporting responses to the pandemic, including some examples related to water and sanitation. Thank you, Rio.
Thank you, Amanda. And OHCHR is very pleased to join this launch event of the Human Rights to Water. This year marks the 10th anniversary of the Human Rights to Water and Sanitation, but this COVID-19 pandemic is posing a serious threat to 2.1 billion people who are currently without access to safe water and unable to regularly and safely wash their hands to protect from the virus. For 1 billion people who live in overcrowded informal settlements and slums worldwide, the rights to water and sanitation are now a matter of life and death. What we are seeing here is that the impact of COVID is likely to further aggravate existing inequalities and entrench discrimination based on gender, ethnicity, culture, socioeconomic status, among others. So OHCHR is actively monitoring the human rights impact of the COVID-19 from Geneva and through our field presences, advocating for the rights of the most marginalized be addressed in the response and recovery. For example, in Kenya, our human rights advisor to resident coordinator and UN country team, soon after the first case was confirmed in Kenya in March, she embarked on a joint monitoring of the human rights impact of COVID-19 in informal settlements around Nairobi, together with social justice centers. That monitoring was undertaken by a smartphone-based household survey, and more than 1,500 households were surveyed. This joint monitoring found that, with regard to rights to water and sanitation, first, already inadequate water and sanitation services were exposing the community to the higher risk of contracting and spreading the virus. Only about 1/3 of the households had access to public water services. For the majority who relied on private water supplies, the availability, accessibility, and affordability had worsened due to the pandemic. And there is a potential risk of worsening this vicious cycle because the rights to water and sanitation are linked to many other human rights, including health, food, and housing. And limited access to water and sanitation leads to a vicious cycle of increased risk of infection, serious health outcomes, and poor living conditions. So governments need to implement targeted measures to break this cycle, ensure the continued and increased access to water and sanitation, with particular attention to marginalized groups and leaving no one behind. To support this effort, the UN Secretary General launched a framework for UN socio-economic response to COVID crisis. Under the leadership of UN resident coordinators, the UN country teams are conducting socio-economic impact assessments with a view to repurposing and refocusing their programs towards supporting national efforts to address the pandemic, including in water and sanitation sector, towards the implementation of the SDG 6. And OHCHR is actively engaged in this efforts at country level and integrate human rights into UN country teams' socioeconomic assessments. Because placing human rights at the center of our response is key to building more inclusive, resilient, and sustainable world after the pandemic. For this, we need to work together across sectors and across all stakeholders, breaking our divides. We need to turn this COVID moment into opportunity, as Desi just said before. And this is where I very much look forward to the work of this new initiative of Human Rights to Water and the partners gathered here today to bring further focus on the most vulnerable and the marginalized, on the challenges that they face, but also on their capacity and potentials as rights holders, and to share good practices and practical solutions. Thank you very much.
Yeah. Oh, thank you very much, Rio. I think it's interesting to hear that, well, how proactive OHCHR has been already in respect of monitoring human rights and how it's connected with this crisis. I'd like to find out more about that. I'd like to introduce our second speaker today. Her name is Raya Stephan. She's an expert in international water law and a director at the International Water Resources Association and deputy editor-in-chief of Water International. Her expertise lies in the design and execution of international projects related to legal and institutional aspects of water management and transboundary waters in various regions of the world. She's joining us today to speak about the importance of introducing the human rights to water and sanitation in the legislative frameworks of national states, starting from the Constitution, and how the courts have a role to play in this. Thank you, Raya.
Thank you, Amanda, for the introduction, and thank you for the invitation to participate in this webinar. As the previous speaker just said, we will soon celebrate the 10 years of the adoption by the UN General Assembly of the resolution, which has given the international recognition of the human right to water. And this resolution was followed in September 2010 by a resolution of the Human Rights Council, which has again affirmed the rights to water and sanitation, and it has specified that these rights are part of international law, of existing international law, and that they are binding upon states. So it is the responsibility, we can deduce from this resolution that it is the responsibility of the state to give a proper implementation of these rights on the ground in their countries. Recently, in December 2019, the General Assembly adopted another of the UN adopted another resolution on the human rights to water, where it has specified that one of the, it's not only one of the means, it said that it's one of the most important means to the realization of the human rights to water and the access to safe drinking water is the adoption of legislative measures. So states not only have to implement these rights on the ground, but they have to adopt the needed legislation to provide for the realization of these rights. So one easy, I would say easy between brackets, of course, is the introduction of these rights in specific legislation, mainly in legislation related to water. This is a trend that we can notice now in the modern evolution of water laws. Many states who are adopting water frameworks, water legal frameworks, or are modifying their legal framework related to water are introducing the right to water and sanitation into these legal pieces. I can mention the example of Bhutan in 2011, Zambia the same year, Peru 2009, more recently Kenya 2016, or Palestine 2014. However, if we want to make this right, to give to this right a higher weight, a sort of a guarantee, its adoption by the Constitution will give it let's say the high level it deserves, because the Constitution is at the top of the hierarchy in the legal framework of a country. So a constitutional right has a higher weight than a right from a law, and the constitutional right has to be let's say is implicitly in all legislation in the country. We have a number of states that have introduced this right in their constitution, and even some of them long time ago. I can mention South Africa since 1996, Uganda 1995. So you see some states are pioneering, because the right to water and sanitation at that time was not even at the international recognition. Recently, Costa Rica, in just a few, maybe not less than a month, has introduced this right in this legislation. And this, I would say, is very important in a time of crisis, like we know now for the COVID-19, or even in another time of crisis, where states are adopting emergency laws, emergency situation laws, because what is in the Constitution cannot be amended or cannot be changed by a law. It is a special procedure. So it's a stronger guarantee, and it reminds that it has to always be there. I can elaborate more if there are questions. And thank you, Amanda, for the sign for keeping my time.
Oh, thank you very much, Raya. I think you expressed the importance of the responsibility of states to adopt the human rights to water and sanitation in legislation, and not just at the top level, but integrate it. And I think you were leading on to say that at times of crisis, these laws need to be there so that we can cope with the emergencies as they arise. I'd like to introduce our next speaker, Bruce Gordon, who is the coordinator of water, sanitation, hygiene and health at the World Health Organization, WHO. He oversees a global portfolio of water and health-related work, ranging from development of norms on drinking water, wastewater and sanitation, to global monitoring of access to water and burden of disease. Prior to joining the water unit at WHO, he contributed to the organization's work on sustainable development with a focus on children's health and environment. Bruce will share with us today how the WHO responds to pandemics and how these can be used for long-term solutions.
Thank you very much, Amanda. And I just want to apologize in advance to everyone, because I'm in an environment now in the emergencies room of the WHO, which is a working environment. And so there's going to be some distractions, but I just wanted to say, obviously, from a WHO perspective, we are, been in the news. It's a time that's been challenging and difficult, and we're working, especially amongst the emergency group, in a very sort of exhausted state. But having said that as an introduction, maybe I wanted to start out maybe 4 points. And the first is around seroprevalence, which is kind of technical, but it's essentially, I just wanted to make the point that when we think about emergency response and the timeframes normally kind of associated with it, when we think about cholera events or even Ebola, it's a lot more of a shorter time frame. And when we look at the number of people that are likely to have gained immunity from this disease, it's in this small percentage, 10% here in Switzerland. So that means that the disease is going to be with us for a long time, and that really forces any of our emergency response work to be really kind of like hitting that issue of recovery and even reimagination, which some of the other speakers spoke about. As far as what WHO is doing and how WASH and water link to that, and how the human right to water fit in, I mean, obviously, hand washing is central preventive action that everyone is rightly preaching now, and which we have even given a directive to all member states to ensure that there's obligatory hand hygiene stations available in public places and outside transport, businesses, etc. But that is also buttressed against this really urgent need. And I think it's always important when one talks about water and sanitation to think about, you know, the other side. And that's, you know, we're desperately trying to get, you know, much needed diagnostics, personal protective equipment, and, you know, clinical care, oxygen type supplies out. And so how does this all fit in? So we have a strategic preparedness and response plan, which is around sort of structured around 6 pillars, and WASH is central to the community engagement and risk communication pillar, but very much it's the whole sort of foundation of infection prevention. And it always has been, as we know well, and that's one of the reasons water and sanitation is a human rights, because of the health you know, element to this, not just for COVID, but obviously for the near 1 billion deaths associated with that because of enteric infections. So the main sort of evolution of the strategic plan, and this came out just a couple of weeks ago, is or even last week, was this whole of society approach, and a real demand from member states to, or request or recommendation, I should say, to really focus in on WASH services as essential services and as contributing to this event, and as and to monitor the extent which they're viable, so that things like hand washing can continue. And my last point is really around this reimagination piece, and that is, you know, when we start looking at the future, there's been a lot of discussion about climate change, and as we move out of lockdown, we do things virtually and take less planes and create less greenhouse gases. But essential services like WASH have to be part of that. It really is fundamentally important that we're not just talking about a greener society and bringing nature back in, which is obviously important, but that we give ourselves an opportunity over the long term to really make inroads on this SDG 6 that Rio mentioned as well. So this is accelerating everything that we should be doing. And the WASH response is definitely part of the health response. They're one and the same. Thank you.
Thank you, Bruce. Am I unmuted? Yeah. Thank you for that. I think it's good to hear from the WHO perspective, where you're right in the thick of things, and that was really quite realistic with all the background noise that was going on. I think that what it brings to bear is the fact that these things that should be happening on a regular basis aren't necessarily happening, and they are preventative as well as cure. And if we're really going to achieve SDG 6, then we need to be looking much more at the longer term for sustainable solutions. And that was very helpful and interesting. Thank you. And our second to last speaker, sorry, is Enrico Muratore. He's a technical expert on leaving no one behind, and equality, non-discrimination and gender at the Water Supply and Sanitation Collaborative Council, WSSCC. His expertise covers the fields of human rights, justice, democratic governance and peace education. He's chosen to share with us some of the WSSCC action to LNOB in WASH responses to COVID-19, including the impact assessment of COVID-19 responses in India on sanitation workers and persons with disabilities. Enrico. He's muted. Enrico, you need to mute yourself.
Yes, yeah. I unmuted a couple of times. I hope it works now. Can you hear me now?
Yes.
Yeah. Okay, thank you very much for the invitation to join this very meeting. The opportunity to present the work WSSCC is now developing from the policy and research angle. So if you do not mind, I would like to share a PowerPoint presentation. So I will share my screen. How do I find it? So I think that I should stop the video first. Okay. Do you see the presentation now? Can you see the presentation? Amanda?
Yes, we can.
Okay.
Yes, we can hear you.
Okay, can you see the presentation? I shared my screen.
Yes, we can. Yes, we can.
Okay, great. So thank you. As you can see, we are going to present a set of different actions that we have undertaken, which are also
And Enrico, excuse me, could you go to full screen, please, so that we can see the full picture? Full screen of your slides.
Yeah. I am not sure it works, but anyway, I'll try again. Okay. Is it better now?
Yes, that's it. That's it.
So I'm not a very technical person, despite my functional title. Anyway, so we are going to present these actions. I was saying our focus in the, first of all, I should announce that probably heard that the WSSCC is now evolving into the Sanitation and Hygiene Fund. So we are work in progress, and the work I'm going to present is work that is going to inform this evolution and development of technical normative content of the Sanitation and Hygiene Fund, which will provide catalytic funding to those countries which have the highest burden in terms of sanitation and hygiene, and the least ability to respond, and the focus would be on prioritizing those groups that are left out of services. So the program contributes to this transitional objective. We have two main goals within the program. First of all, in the area of research and evidence, to take stock of the state of the domestication of the human rights to water and sanitation. Many people already read that. So the proposal was made by the Special Rapporteur on Education at our joint roundtable with OHCHR in New York to precisely go in that direction, and we'll see the steps taken later. And then we are promoting inclusive global and national policy dialogue, promote rights-based approaches to national SDG planning and the identification and inclusion of those groups that are really missing the conversation and the seat at the table. And we are doing this through a partnership that, as I was mentioning, we have launched with OHCHR. We, first of all, organized an expert consultation. You can maybe recognize in the pictures Rio Hada, and by his side, the Special Rapporteur on Education, who also attended this event together with those groups who are ESOS network, vulnerable organizations in New York UN processes. And the picture to the right, you can see it's taken outside of Wilson, of the lake. We had a similar meeting here with all the actors that intervene in Geneva-based processes and accountability processes, and we have made sure that precisely those groups that are not usually sitting at the table be represented. And at the country level, we are also proceeding in the same direction that was being mentioned by Rio earlier. Said that the LNB work in the COVID responses is being coordinated by the UN country teams. So this is an effort to mainstream, leave no one behind, inequality, discrimination, and gender, the action of the country teams and the support to states and the planning, and that has started a few months ago. You can see this picture, which represents the LNB consultations that WSSCC has supported in India, 14 different groups to contribute to the DNR report to the HRWS. That was still before, of course, we were aware of the pandemic that was reaching us, but after that we had to review our priorities. Fundamentally, we didn't need to change substantially our approach, because our approach is always to try to bring the people to the table and to ensure that they are heard. But anyway, all our programming and research is now based in the COVID context, and we're going for 8-country reviews, always with OHCHR, WHO, UNICE, on the domestication of the human rights to water and sanitation and measures to leave the one behind. A report by the UN Special Rapporteur on Education on human rights to water and sanitation. The right to education, imagine reopening schools now when water is not present. We are also planning roundtables. We will share more information with you about it on deepening disengagement of vulnerable groups with SWA and dialogue that takes place on that platform. So coming to India, we are supporting a 2-phase assessment. Now it started the socio-economic impact assessment phase, and then based on the results of this analysis, we will be able to start the second phase, which will be both sector and human impact assessment. We support FAMSA, which is a network of water organizations in South Asia, to interview 2,000 sanitation workers and 1,000 persons with disability in 15 states. And this wealth of information will influence the reprogramming of the UN country team. Other agencies are taking up different groups, and also will influence the response of the government of India. But we are not sure at this point that we will be able to make it public. To conclude, I would like to thank you, and sorry if I was a bit long, but we have many things to say, so little time.
Thank you very much, Enrico. That was great. Can you kindly unshare your screen? Great, there we are. It's interesting to see what some of the larger NGOs like yourselves are actually trying to do on the ground in terms of active interviewing and monitoring of the situation. I'd lastly like to introduce you to Sharmila Murthy, who is an associate professor at Suffolk University Law School, where she teaches and writes on issues of property law, environmental law, international environmental law, poverty, and human rights. Previously, Sharmila co-founded the Human Rights to Water and Sanitation program as a fellow at Harvard Kennedy School Carr Center for Human Rights Policy. In 2014, Sharmila was selected as a finalist for the United Nations Special Rapporteur on the human right to safe drinking and water and sanitation. She is also a board member of Human Right to Water, and she is offered today to connect the responses presented in the previous sections with human rights law and potential. Sharmila.
Hi, everyone. It's really a pleasure to be with you, and I want to thank Amanda and the Human Right to Water for organizing an event that is so important. We are living in a moment that is fundamentally changing us all. We are losing people, we are living in lockdowns, and it has really highlighted the importance of access to safe drinking water, to effective sanitation and hygiene for everyone. In listening to the speakers today, I wanted to highlight 5 themes that I heard. Number 1, why human rights? Human rights is fundamentally about human dignity. And we heard Desi start us off with thinking about South Africa's own history and experience. And the COVID crisis has underscored that we are all in this together, that this is a matter of life and death, as I think Bruce mentioned, that it underscores the importance of participation and setting goals that we can achieve, but that are also aspirational. This is in part why thinking about water, sanitation, and hygiene as human rights is so fundamental, because it ties back to our fundamental belief in human dignity. Number 2, disparities. thinking about the poorest and the most vulnerable. And I think Rio's comments really spoke to the importance of thinking about not just how are we protecting ourselves, but those who have the least are experiencing this the most. Those living in slum conditions, in poor conditions, without good access to water, sanitation, hygiene, they are on the front lines. But yet, this is not just about each person, because COVID, unfortunately, has reinforced to us that when one person suffers, it actually affects all of us. It affects public health. This brings me to my third point, which is what Bruce talked about when he was talking about the timeline, that COVID will be with us for a long time. And here is where human rights gives us that long time horizon. And when we heard, for example, the goals that Enrique was talking about, these are goals that we are, and plans that we are trying to achieve. Water and sanitation and hygiene. I wish we could snap our fingers and everyone would have access that we consider to be acceptable and affordable and of safe quality, but we are marching on a road together, and together we will eventually get there. The fourth theme that I heard, the importance of human rights, bringing that language into the dialogue, is the way in which it can connect different sectors and different people. So for example, we heard about the normative content, that it's available and accessible and affordable and safe. And yet we also heard about Desi talking about the water sector, right? And the need for there to be new approaches and new thinking. And I think that the language of human rights, the way in which human rights and legal experts can speak to water practitioners, this is an important dialogue that we need to continue, and it gives us really a lingua franca to be able to understand what's our goal and how are we going to get there. Finally, scale. Raya really talked about the importance of having that fundamental recognition of the right to water, the right to sanitation, ideally in a national constitution, but yet whether it's in statutes, legislation, policies at the utility level or at the local level, this is a question of scale. So human rights also highlights for us the importance of solutions at the global level, the national level, but also at that local level. And once again, returning to that first theme of human dignity, the human rights language really gives us a way to think about how do we expand access to water and sanitation and hygiene for everyone. We are living in a difficult moment, but yet this may be a moment that we can seize to really make the world a better place. Thanks.
Thank you, Sharmila. That was a very nice pulling together of all the points that were made today. And I think your point that those that have the least are impacted the most is probably one of the most important driving factors for us to really try and get the messages out there that human rights to water and sanitation need to be integrated into legislation. The panel is now open to questions. We'd like to invite a few of the board members from Human Right to Water to first share their questions. And if we have time, there's an option to send us questions through the Q&A tab at the bottom of your screens for us to ask the panelists. First, I'd like to invite Mariette Verhoef-Cohen, who is the President for Women for Water Partnership, to take the floor. Mariette was also immediate former president of Optimist International and an expert in the education, empowerment and enablement of women and girls, and ensuring that they have the capacity, experience and vocational training needed to manage water resources and gain careers in water-related professions. Mariette.
Thank you very much. Welcome everyone. It was very interesting. Sharmila, it was very clear you got all the speakers together, so I was very happy with that. And as we all said, or you all said, that the current ongoing COVID-19 epidemic pandemic is the water security has been gravely exacerbated, and which results in leaving many, specifically women, behind. The most vulnerable from economic uncertainty and water stress. They are the poorest from low-income countries, and they suffer most. I mean, I think everyone has already said that. And that is why the gender aspects are so critically important. And that is why we at Women for Water Partnership try to link SDG 5 and 6. So my question is, how do we implement? What are the implications of women in this whole subject, and how can we support them? Because I think at the moment, whatever you read economically, ecologically, or water, on the water front, women are being left behind and are victims, which we don't want to happen.
Thank you, Mariette. I'd like to quickly pass to Bruce, because I know he's got an emergency to run to, emergency meeting, I should say. Bruce, would you like to give your response to this question, given that you need to leave soon, and maybe we can ask other panelists for the other.
Yeah, thanks. It's not an easy question, and I don't know if I have all the answers. I mean, like even in my own house, I can see, you know, how a lockdown has affected like a mother and, you know, someone who's a professional, and, you know, and I'm suddenly have gone to work getting called into this essential service thing, and she's left doing 2 jobs, looking after the children, and doing everything else. And I think you're right. I mean, we do this issue of how do we support. We know that women play a massive role in water and sanitation. We know they're community mobilizers. We know they're frontline healthcare workers, and they're caregivers generally. And so, I mean, then the question is, if you want to disentangle that, you know, how does society actually support that role and enable a little bit of free time? And I do think, you know, even if we look at ourselves personally, I mean, if we do get more flexibility with work, then I think men need to do a better job in terms of ensuring that women are able to do their work without, and that work could be water and sanitation. It could be fetching water. It could be all the things we know about, this burden lying on women. But now I think is a time like for those sort of classical understandings and concerns to be taken a little bit more seriously. And I think we know, you know, what they are. You know, and obviously just simple things like maternal health and having wash in healthcare facilities. We know this has been a big concern of WHO's over the last 4 or 5 years when we've got the data coming in. And so, you know, getting those services in maternal health up and running as an essential service, keeping those going is important. And maybe just before I leave, I see Neil, I did get distracted by the chat, and I saw Neil Diot has asked a question about money. And that's a really good question. Where's all the money going to come from for this? You know, and I think, I don't know if it's the right question, but let me say, I mean, because I think everyone is asking that question. Sorry, I just took this opportunity to talk about
Absolutely,
money. But,
yeah, don't worry.
you know, we're mobilizing about $1 billion worth of, you know, essential medicines here, but there's nothing really going to water and sanitation. And I think we need to make a better case for how we can cost it, how we can implement it. It needs to be more structured and systematized, so that investors can see it as something that is, you know, not necessarily on a 15-year time horizon in a big fuzzy development space, but something that's a little bit more immediately kind of investable over.
Very, very good point. Thank you. I'm glad you picked up that question on the chat as well. Thank you, Bruce. I think that, I mean, this is my big worry, is that very little money is actually going into water and sanitation solutions long term that are going to really solve the problem. I think I'd also like to direct this question to Rio. Rio Hada as an expert in some of the issues that are impacting women, particularly in the wash sector. Rio Hada.
Yes,
Yeah.
Thank you, Amanda. Well, yes, on gender, I'll go back to the this assessment in Kenya that I mentioned during my 5-minute presentation before, because many of the issues emerged there really highlighted the interlinkages of rights to water and sanitation with other rights, but also the gender dimension. And it was clear that COVID is accentuating the existing gender inequality and multiple challenges that underlie the lack of access to water and sanitation. So for example, it's usually the task of women and girls to collect water, and obviously this exposes them more to the risk of getting infection. Before COVID, because of lack of security, women in informal settlements in Kenya, they end up paying cash to men to escort them to water points during the night. Now during the lockdown, more incidents of sexual and domestic violence against women and girls have been reported. And more broadly, we know that women are overrepresented in health and care sector, as Bruce just said, where the risk is very high. Women are also majority in the informal economy, not having access to social security, social protection, to cope with the social economic impacts of the crisis. So developing gender-specific policies and programs is very critical, targeting female-headed households and women who are at risk. But also we need a broader measure to achieve and accelerate the achievement of gender equality and address many of those, the root causes of inequality that's faced by women and girls. Thank you.
Oh, thank you very much, Rio. I think it addresses a little bit of what Mariette is talking about. It's a huge problem, obviously. So we have another question from Dr. Anand Chiplunka, who is a former director of the Asian Development Bank in the Urban Development and Water Division in Central and West Asia Department. Dr. Chiplunka has a unique expertise in more than 3 decades in the field of urban infrastructure development and environmental management. Anand joins us from Pune in India. Anand, would you like to ask your question?
Thank you, Amanda. You know, having been in this sector for more than 3 decades, it was with a lot of interest that I noted the UN resolution to make water as a human right. And when we look at today's COVID situation, we find that water, wash, and some of these remedial measures are emerging as the forefront ways of even fighting COVID. My question is that what would be the responsibilities of utilities as far as providing water services, sanitation services are concerned, especially considering the vulnerable and poor who may not have these services, and yet that's the only way, as for example Sharmila said, that it affects all of us. It affects the poor and vulnerable. We are going to be interacting with them, and therefore what is it utilities can do to avoid the spread of COVID under these circumstances? Thank you.
Great, thank you. Thank you very much, Anand. If I may direct that question to Raya, please. Raya Stephan.
It's a very important question because it's really what happens on the ground when water utilities are providing the access to water and eventually to sanitation also. So when as I mentioned in my talk, when the right to water and sanitation is included in a law, in a water law or whatever law, it's then the utility has to comply with the law, and usually it's part of the authorization that it gets to exercise as a water service provider. And and of course there are mechanisms, some compensation mechanisms from the state for the utility to provide water for the poor. There are limits, and even there are rulings from the court when utilities they see this right and they still cut water for the poor, or they do not do the essential work to reach the poor or those who cannot pay for water. And there are courts decisions in some countries which has really obliged the water service providers to continue the service even when there are some financial issue, the poor or whatever cannot access water. So this goes back to the essential thing that I mentioned, is to mention these rights in the legislation so it applies to the utilities and to the authorization the states gives them to exercise the supply of water and sanitation.
Thank you very much, Raya. We have one other board member present who would like to ask a question here. Max Campos, who is Senior Chief of the IWM Division at the Organization of American States. He has a long profession in science administration as well as on formulation and evaluation of projects, working for several international organizations. And through his work, research and publications, he's contributed to the development of the agenda on climate change in Latin America. Max is calling us in from Washington, D.C. Max, have you got a question for us?
Let me unmute my, okay, I'm on mute now. Yes, I would like to address my question to Sharmila, because I like very much two keywords that she mentioned. One is participation and also aspirations. And when we talk about aspiration and participation, we're basically talking about the youth. And I think that they have a major role in all these issues associated to the human right to water, in particular because it is not only the law that we need here, but also we have to engage and to also to open doors and open opportunities for this new generation to participate. And I think that this COVID has bring us to attention that there is also some kind of divisions between the younger people and the older people on how to address things. But I think that human right to water is something that makes us converge in the common interest. So my question to Sharmila would be, from the perspective of the basin organization, the river basin organizations, how can these authorities use this momentum to motivate the youth to engage more into the human right to water?
Sharmila, would you like to address that?
Sure. So thanks. It's a great question, and in some ways, I like to think about it perhaps in two different ways. One is, I think Desi's comments at the beginning were a great segue into this whole discussion, because he talked about that it's the month of youth, and we know that youth are always pushing the vanguard. And something that Rio mentioned in his comments about the role of technology in monitoring. I think that their youth are important, not simply because they bring the vibrancy and a vision of a world that perhaps those of us who have been around can't see anymore. They also bring a comfort level with technology and the way in which, for example, mobile reporting and other ways that we might be able to use mobilize the youth, not simply to be demonstrating in the streets, but also perhaps to helping us gather the information that we really need. And if we're thinking, if I might also just make one response in response to Anand's question, when we think about utilities, one of the things that I learned recently about COVID is that wastewater treatment, you can actually detect COVID, the coronavirus, in wastewater samples. And that fact to me just highlighted just the critical importance of not just access to sanitation, but actually having effective treatment, and then the ability to actually monitor and measure that so that we can better protect the public health. And I think that coming back to Max's question about youth, I think that for river basin authorities that are thinking about planning and planning for various scenarios. I know in the chat, a number of people have been questioning about climate change and other things that river basin authorities need to be considering. Another piece of the puzzle is, who are you talking to? Who are your stakeholders? And thinking about mobilizing the youth and really how can you both get their input, but also enlist their support to really trying to pave the way for a better future.
Thank you, Sharmila. I think that that leaves us with just a few minutes to wrap up today. I've noticed quite a few interesting questions, and in fact, one from Michel Jarreau about the possible indicators to monitor progress for human rights to water and sanitation. And I think monitoring is something that's coming out through a lot of these discussions. Human rights monitoring, which is looking at what do we need to measure that is going to enable us to actually do a better job and make sure that these laws are integrated in practice. And that's looking at monitoring at a disaggregated level, but also thinking differently about what we need to measure. Like Sharmila says, it could be wastewater quality, could be giving us other information that we didn't realize is available. But actually the ability to see who is having access to water and sanitation, especially in a situation that we have at the moment with the current crisis, that facility to monitor data and track it is what is going to enable us to achieve SDG 6. Because those people that have constantly been left behind, those are being highlighted through this crisis. And it's bringing home to governments their responsibilities. And my hope is that one of the silver linings that might come out through this horrible period of time that we're going through is that governments will have the ability to actually put a bit more budget into thinking about long-term water and sanitation solutions that are really going to be dealing with some of the problems that vulnerable people are dealing with, that the women and girls are dealing with in terms of water and sanitation. And so our hope is with this webinar highlighting these issues is that we can perhaps generate a little bit more enthusiasm and focus on how do we integrate human rights to water and sanitation into legislation. And that will give us a more sustainable solution, eventually. I really would like to thank all of our wonderful panelists today for giving a different perspective on this, and really from a personal point of view and their own side of expertise, bringing together what is not an easy solution to solve. Everyone knows what it means in general terms to achieve human rights to water, but actually what does it mean in terms of solving it? That's the difficult part, and it's not just one solution. So please join us next month. We'll do another webinar on a similar topic around human rights, and we would love to see you again. And may I say again, thank you very much to all our panelists. And we have 2 minutes. Des, if you would like to say a final word, there is room.
Oh, thank you very much indeed. I agree with you that the participation and the quality of inputs has been truly excellent. And the chat line has raised many questions, and I think many conversations that we're going to pick up. I just want folk to know that as an organization, we're going to interact with you in much greater depth to actually unpack many of the things that we talked about today, and some of the things that we implied but didn't get a chance to unpack. The parting point I want to make is for us to be hyper aware of two things. The first of those things is that people are making decisions associated with the emergency measures related to COVID-19 that are going to have a lasting impact. For those of us who are thinking that these are decisions for the next 6 months or so, we're frightfully wrong. The reprioritization that is happening now is going to impact what water and sanitation is going to look like for the next 10 years at the very least. So there has to be fairly good care and consideration in those decisions. The second point is that there is an availability of money. There's a vast amount of funds available in pledges, available in loan schemes, and available in special grants. But again, we have to make sure that they are directed into the right priorities with the right underlying paradigm. Colleagues, it's been an absolute pleasure, and I'd like to thank all of you. Thank you.
Thank you so much.